My name is Mark Opowski. I'm the CEO at Sparrow Bioacoustics. And this is our launch party for Canada. I want to kick off the night by introducing the founder of the company, an incredible individual who was one of the main reasons that we're all here even doing this. And she's going to share a few words with you to get us kicked off about the company and about why what we do is important. So with no further ado, I'd like to introduce Nadia Ivanova.
Many of you know Sparrow by now, I assume. But not so many people heard why we created the company and how that all happened. And I usually don't share this much, but I felt that today it's important for understanding the mission that we all carry in our hearts. 11 years ago, I got very sick, and my heart was damaged, and half of my body was full in blood clots. And the doctors didn't know what to do. They were amused, they'd never seen anything like this, and the medicine was not working. And it was 1 month before my son died. And fairly speaking, that was the moments when I didn't feel the reason to live. And there was that night when I already couldn't move, and I only could think. And what I was thinking is that people should not find out about their disease when they're in ICU. They should find out about this early, so everything could be prevented. And at that night, I made a wish. If I survive, I'll put my life as something important. And surprisingly, next morning, I woke up, and the medicine started to work. The doctors were surprised. But since then, well, it's been 5 years. And after several startups and tries, I met my core team, and we decided to create something that never been done before. Something important for everyone. We decided to create something that everyone considered impossible at that time. We decided that people could check their health using their smartphone. So here we are right now. We had so many people joining us in our mission. And just yesterday, I was talking to my co-founder, Yaroslav, and he asked me this question: what was the hardest thing in our journey? And fairly speaking, the hardest thing was the thought that I may fail the people that believed in me, people that believed in our success. So I think today we do have a success. And I'm proud to say that today, Stethophone is available across Canada. And hopefully, one day, it will be available on every smartphone on this planet. So please join me to welcome Stethophone.
Thank you again. That was outstanding, and I've heard that story obviously a number of times, and every time it really grounds all of us at the company as to why we're here, and what the mission is all about. I've got some personal connection with cardiac disease myself and with cardiac conditions. You know, I was, for those of you who know me, 5 years ago I became extremely sick. I wasn't expected to live. The only reason that I didn't expire over the many weeks that I was on life support was because my heart kept beating, and it took a lot of damage, and there was a lot of recovery that was required there. So I became acutely aware of something I'd never really thought about very much before, which was my own heart health. Like many of us, I'd lost a parent to sudden cardiac death 25 years earlier. My father was a fit man, an active individual, and his heart stopped beating one day. And I'm convinced now, and I've remained convinced for many years, that there would have been signs, signals, arrhythmias or murmurs or something that was missed along the way. And it's deprived my children from ever meeting their grandfather, and mercifully the same thing, you know, didn't happen to me. After I recovered, a couple of years later, I met Nadia. I met the founding team at Sparrow. And as you just heard, they had some pretty strong opinions about cardiac health, not just from the medical perspective, but in particular from the perspective of being a patient. This is intriguing because up until now, most medical devices have been created to service doctors so they can offer better care, which is a wonderful thing. But what about medical devices, real medical devices that work between the public and the doctor, that goes beyond the clinic? This concept and the idea that we could potentially help millions of people was absolutely fascinating. Even if we could only achieve a small fraction of that, it could change the lives of millions of people. Well, I wanted to be part of that. And mercifully, I was asked to join, and now here we are. Sound. We use body sounds. The sound that your body makes when it's working, the sound that your heart makes and your lungs make and your other organs make, is diagnostically extremely rich. There are over 100 diseases that create abnormal sounds. Some of these sounds are very hard to hear. Some of them are on the edge of our perception. Some of them take an extremely trained medical ear to understand and discern. Many of them come and go. So they're not always there to be observed at the time that you're standing in front of your doctor for those few minutes a year. And so lots of diseases in the early days that are creating these sounds go unobserved. This is a huge opportunity to observe these sounds, to record them, to help identify them, take some of the ambiguity out of it, and help doctors put people on the right care path earlier before things become acute, before things become critical, like they did for my father and for so many other people. Heart disease and lung disease are the #1 causes of death on this planet. It's an amazing thing to think about. And I've seen this many times, oftentimes the first indication that somebody has heart disease is death. It's being found by more coroners oftentimes than it is by primary care physicians. The CDC in the US claims that there are almost 100 million people with some form of cardiovascular disease, albeit mild or moderate. It's a staggering number, staggering. There's a study in Canada that says that women in Canada are 6 times more likely to die of cardiovascular disease than they are of breast cancer. It seems to me we need a more effective way to screen for something like cardiovascular disease. We need a more effective way to put people on the right care path earlier. We can't be finding these things out once things have already become acute. These are, after all, progressive diseases. On the other hand, there are 7 billion smartphones on the planet. They are plugged in, they're in people's hands, they're connected, people know how to use them. No device in the history of all humans has been this sophisticated and this ubiquitously available. We could turn those devices into cardiac scanners. We could modernize and democratize the whole idea of a stethoscope and make it a completely different thing that's pushed out beyond just clinical use, but right into the home. Imagine the impact of something like that. Of course, as Nadia alluded to, this had never been done before. I mean, a medical device usually required a device, some kind of thing that you made that in a factory and that you shipped and that you maintained. We had to figure out how to take generic smartphones and have them achieve, in this case, the quality of audio, or even exceed the quality of audio of the world's best digital stethoscopes. And then we had to figure out a way to teach an AI to understand what these sounds were, to remove the ambiguity of it. And we had to make it simple for people to use. There was no data to train the AI. We had to go get that. We had to literally go and ask people to let us, record their hearts. Even after all the heavy lifting of the science and the regulatory pathways and all that ambiguity, there was still the ambiguity of the business model. See, we're not really replacing anything. And so when you're not in a replacement market, innovation is hard to explain to people. Where does it fit? Who's going to use it? Are people really going to do this? But that is also where the greatest economic and social advances happen, is when you go after a place where there is demand, but we haven't quite been able to fill it with the right product or the right technology, the right service yet. And I truly believe that this is what Stethophone represents. We think it's potentially transformative. It comes down to people. The type of people you need to do a project like this are very unique. You need folks that can think out of the box, but are also fundamentally pragmatic. You need people that are critical thinkers, but are also huge optimists. And you need to work with people that love and want to build something, but also want to help people and want to do something noble and want to make change. I'm thrilled that we've been able to pull together a team of people at Sparrow that meet all those credentials, that we have found and had the privilege to work with investors, some of whom are here tonight, that embody all those characteristics, that we've had support from the province, that we've had support from doctors all over the world, and frankly from even thousands of people that let us record their chest sounds and send them in for echocardiograms to help train the AI to build the database that fuels this thing and that keeps growing every single day. Starting tonight, as Nadia indicated, this product is available in Canada to anyone on the Apple App Store. It's a product that you download onto your phone. You then hold the phone to your chest. It listens to your heart. It then does an analysis where it looks at your cardiac cycle, looking for arrhythmias and graphing them in ways that people can understand, hopefully, and that doctors can assess. And it hunts for heart murmurs. These are indications that there are structural anomalies with your heart. Now, just because you find a heart murmur or an anomaly in your heart rhythm doesn't mean it's acute. In many cases, these things are completely benign and innocent, but we think these things need to all be checked out. They could be the underlying early signs of disease or disease progression. In the future, in the near future, we will be releasing additional abilities. As the AI grows, we will be detecting more diseases, or detecting diseases more specifically, or detecting the progression of diseases for people that already have them. We'll do lungs. Lungs are huge. Lungs are important. We will do juvenile indications. Kids are important too. We keep adding additional layers to this product that will draw in more people, that will create more value for larger groups of folks, that will then generate more data, which will help us create more AI and more value. It's a noble circle for what I think is an extremely noble problem. There is no product like this right now. There never has been. This is the first time anyone ever tried to create a software as a medical device of this exact kind and put it on smartphones. It is arguably the most scalable medical device at this level of diagnostic capacity of its kind. It's certainly, arguably, the most accessible medical device at this level of sophistication. And importantly, it's Canadian. That makes me proud. It should make us all proud. We have an amazing opportunity here to lead not only medical AI, but to do a thing that actually helps not just a few people, but actually helps transform how people enter medical systems all over the world, how patients advocate for themselves, how they create agency when they know something is wrong, when they've had a symptom that comes and goes, but they're not quite sure what to do with it. That is where the disease happens, out there, when people are at home or at work, not just when they're standing in front of their doctors. So, tonight is a celebration of that. Thank you for being here. Thank you for joining us. Thank you for being part of this little slice of history. Thanks. So there are demonstrations over here if you want to see the product working. You can even try it out. We've got wine, we've got food. You may have noticed that already. Please enjoy yourselves, mingle, have a great time on us. Thank you so much.
On our mobile, and we are authorized by Health Canada and by the FDA as well. So it gives you some leverage to go to the doctor and say, look, this is not just any app, this is serious.
Have you or someone you care about had a heart health concerns?
Yes.
Could you imagine a technology like Stethophone becoming a common household medical device, like a thermometer, for instance?
I would hope so.
Have you tried already? Did it seem easy for you to use?
Like 5 minutes ago, I had a chance to try it by the first time. I never tried it before, and it looks really simple to use, and it doesn't need any additional. Because I was thinking, do you need to have like special knowledge about application? Like I really didn't know how it looks, so I just had a chance to use it, and it's really easy application that I think everybody will be able to use with no problems.
What do you think is the most compelling feature of Stethophone?
The fact that you can record and store the digital heart sounds at the moment of point of care, the first time. So for example, any patient or any person who encounters any difficulties with it, they can record it right there at the convenience of their home and store it and come bring it to the physician, and show them or let them hear saying that this is what was happening when whatever problems they had, an arrhythmia or a syncope or a tachycardia or whatever.
Certainly. Could you imagine a technology like Stethophone become a common household medical device, like thermometer, for instance?
Oh, absolutely. It would be like blood pressure equipment, like your thermometer, heart rate, whole thing. Yeah.
Have you tried already?
Yeah, I just
Okay.
tried it.
Did
yeah.
it, did it,
I
did it seem,
passed.
did it seem easy? You passed. Yeah. Did it seem easy to use?
It was very easy. Yeah.
Would you show the results to your doctor?
Oh, absolutely. Absolutely.
Do you think a technology like this has a potential to reduce costs in the healthcare system while also helping a lot of people to get the right care at the right time?
Yes.
So, have you or someone you care about had heart health concerns?
Yes, somebody I know.
Okay. Could you imagine a technology like Stethophone becoming a common household medical device, like thermometer, for instance?
Absolutely, I think it'd be really great to have it in-house so people can have an understanding of their heart health ahead of getting an appointment with a doctor, and particularly in this current climate where it's hard to get in to see a doctor or especially a specialist.
Do you think a technology like this has potential to reduce costs in the healthcare system while also helping a lot of people to get right care at the right time?
Yes, I absolutely think it'll help reduce our healthcare costs, particularly here in Canada. It's really hard to find a doctor, and there's a lot of health problems out there. So if we can have a bit more preventative care in Canada, I think this product will help with the preventative care and hopefully save lives and help people get the help they need prior to that.
Do you think a technology like this has potential to reduce costs in the healthcare system while also helping a lot of people get the right care at the right time?
Yes, yes, I think it is. It can do, because we don't have too many doctors in the province. It can help. It can help if people live in small communities. Also, if you cannot move from one place to another, especially if you are a senior.
Could you imagine a technology like Stethophone becoming a common household medical device, like thermometer, for instance?
Yeah, I think for sure, especially like even just with AI, seeing how much like AI things like ChatGPT have like become household names, having something like so readily accessible like a phone, and then combining that with like the real world helpfulness of an AI that we've already seen, like it's not as much of a scary thing I think as a society anymore, that putting those two things together, like I think easily it'll just be everyone will be doing it. It'll be just, yeah, like exactly like you said, something like if you feel some sort of strange like faintness or something, you can just test that out before you go to the doctor.
Would you show the results to your doctor, and how do you think they would react if it found something new?
I'm not sure. That's a really good question, because I know Yaroslav was saying that like there's been a lot of doctors who are really excited about using it, so I think that's hopefully that's the feeling of most doctors out there, and they would be really like open to it because it just relieves so much pressure on the healthcare system for like in that it's just like an initial screening process.
Have you tried it already? Have you tried it?
Yeah, we both did.
Oh, nice.
Yeah.
Did it seem easy?
Yes. Yes, definitely.
What do you think is the most compelling feature of Stethophone?
I think accessibility. I guess having it on a smartphone, having it available to you all the time. I know that the thing with heart murmurs is that they're not always like consistent, so being able to just pick it up and use it instead of having to go to a doctor when it might not be active or happening at the time.
Could you imagine a technology like Stethophone becoming a common household medical device, like thermometer, for instance?
100%, without question. That it's available to be used by consumers on their smartphone, which every single person that I know has one, and if it can be that accessible, that's going to be a huge benefit to hopefully the health of every person who uses it.